What do you think has been the impact of the Affordable Care Act in Wisconsin, Mark?
I think it's been good. I think hospitals that had lots of non-paying customers are now having a higher percentage of their clients actually able to pay through insurance for their health care. So I think those hospitals that were taking in people that weren't fully insured in the past are probably going to be better off. There are some difficult aspects of the Affordable Care Act. Some people were forced to change from the insurance they had, and if their area had limited number of options, it could have been rough. But I don't know anyone that wants to end insurance coverage for children under 26 that can get coverage to their parent's employer now. I don't know anyone that wants to go back to the $1 million lifetime maximum. If you have a chronic illness, you could easily run out of insurance under that system. Nobody wants to bring back pre-existing conditions where if a family member had an ongoing condition, diabetes, something like that, where the parent couldn't change jobs out of fear that that condition would no longer be covered because it would be a pre-existing condition. Nobody wants to bring that back. There's so many aspects of this that we like. If the public's dissatisfied with it, then work on amending the parts they don't like and paying for the changes they want to make. Don't throw the baby out with the bathwater.
Senator Baldwin has said she thinks the ultimate answer is a single-payer system. Do you agree?
Well, I'm not going to rush headlong towards that. I mean, that could be a solution over time, but if we do that, we have to be willing to pay for it. But I think this system that is largely government support for a network of private insurance is probably a good answer for now. Let's make this work first.
It's anti-business. Okay, the employer mandates are things that are causing employers to say, we're not going to hire as many full-time people. It caused a tremendous amount of uncertainty out there. One thing that's not talked about anywhere near enough, but I wish was talked about more, and we're going to talk about it, I think, later in the interview, is the huge marriage penalty associated with that plan. I mean, just like anything based on percent of poverty, it creates a situation where if you're married, you're much less likely to get the subsidy, and if you work hard, you're much less likely to get the subsidy. And I think that is an understated, under-publicized problem with Obamacare.
Okay, you just mentioned the marriage penalty, but what about the benchmark, percent of poverty as a benchmark for so many federal and state programs?
It's a problem because when you begin to say percent of poverty, what you do is you create a situation, first of all, as you work more, you work your way out of eligibility or work your way out of the subsidy. So I don't care what program it is, the low-income housing subsidy, the food stamp subsidy, anything, it discourages work. And even more, if you are in a married couple and one of the two couples is working, very likely you're working your way out of these subsidies. So it creates a situation where if you marry a working person and are getting subsidies now, you're going to lose those subsidies, which is a huge problem.
If poverty is the wrong index, what's a better index, Senator?
Well, I think what they have to do is they have to flatten it out so you don't have these huge cliffs in there which discourage work and discourage marriage. Plus, I think the subsidies in the first place can't be as generous across the board, because when you have a situation in which you wind up with total subsidies of $30,000 or $35,000, you're going to wind up with negative income tax rates.
So are you going to go to Washington if you're elected to kill the Affordable Care Act?
Right, we're going to vote against Obamacare. Now, obviously to repeal it altogether, I think we're going to have to wait until 2017, but that's certainly the goal.
Well, what about the three popular provisions? No pre-existing conditions, no cap on benefits, and children can get health care through their parents through age 26. Are those worth keeping?
I have not heard any Republican congressman that I am aware of who is there currently who is opposed to leaving in the thing on pre-existing conditions.